Keep in mind, straight people can get HIV too, and straight people might need PrEP as well. Straight people who wouldn't need PrEP are straight people who are in monogamous relationships and trust their partner. It is not the being gay that makes somebody need PrEP. It's the orgies that make somebody need PrEP, or the treating sex like a handshake among friends that makes somebody need PrEP. If you are straight and you are doing that, you will need PrEP. If you are gay and you are monogamous, you will not need PrEP. When the act was passed, it was mandated that all insurance plans have to pay for this. So if a person is sexually active, they have to pay for this. Obamacare has made things insane because insurance companies can't say, well, we won't take you. You need to go for a higher cost insurance if you're going to make these lifestyle choices. Because at the end of the day, going to orgies is a lifestyle choice. Again, it's not just that it's affecting insurance. A number of states just offer this for free to people who want it. People pretend like this stuff, money comes from nowhere, but no, it's always from something. If it's going to this, it's not going to sick kids. I actually want to point out the perversion of a society that sees it as a moral necessity to pay for a drug that enables sex whenever you want, but that doesn't see it as a moral necessity to pay for IVF, the creation of new human life.
Oh, shit.
Would you like to know more?
Hello, Simone. I'm excited to be here with you today. Today's episode was inspired by actually an episode that Short Fat Otaku had done that opened my eyes to something I had no idea was going on. And it means when you ever look at your healthcare bills and you're like, why is Obamacare so unaffordable? Why is it so unaffordable to force everyone onto the same healthcare plan? And the answer, it turns out, is gay orgies.
Among other things, but definitely it seems gay orgies.
In part gay orgies, yes. So we're going to get to something, and I don't think that there is actually that easy a moral solution to this. Like at first, it's going to seem like, oh, obviously you should do X. But then when you think about it for a second, you're like, oh, but that'll have some really negative downstream effects.
I don't know. I have maybe some moral equivalents, so I'm excited to discuss this with you.
So what started was a Twitter fight. So I will describe to you the first tweet in this chain that led to the Twitter fight. Plant Mommy Pacetis said, realizing that sex doesn't have to be this sacred, all-important thing and can instead just be an expression of affection between friends who are dear to one another is honestly the most life-changing realization for me, surpassed only by realizing that I'm a girl. So this is obviously a trans person they're pointing out here and saying, well, because most girls don't realize they're girls. I
don't know. I feel like I realized I was a girl when your mom was like, did you know that you can dress nicely and wear makeup? And I'm like, oh, wow.
But I want to reread what we're saying here, right? Because I actually think this ends up being important to the conversation.
Yes.
That the huge realization for them, that was the second biggest realization they've had in their life, that sex can just be an expression of affection between friends.
Just a fun thing to do.
With your friends.
Like going out and getting drinks, going hiking.
Going out getting drinks, going out having sex.
Okay? Yes.
Then a person responded to them, Mia, aren't we in another AIDS epidemic or something? Y'all are seriously tripping. And then the original poster replied, I literally take pills every day that make it so I can't contract HIV. And then Short Fat Otaku butted in here with the SpongeBob fish meme looking like, and says, you need to take pills to not contract HIV. You can't just not have sex with people who have HIV. And this tweet blew up. It's at 9.3 million views now. It went super viral, and with a lot of hatred as well. It's considered just a completely out of line thing for him to say, that they should be, that he, from his cultural perspective, that he expects them to exercise any level of sexual constraint. But this just opened a new world for me. I was like, wait. There's a pill that can keep you from getting HIV now? I did not know about this.
But isn't it called PrEP? Like, I'd heard of people taking PrEP.
It is. We're going to go
friends
into
who take PrEP.
What this pill is, how it works, how well it works, etc. Because that was one thing I didn't know. I also didn't know that the drugs around HIV are so good now that generally if you're on them, you're non-contagious. So, this is needed more for people who aren't already on drugs or don't know that they have HIV, i.e. this isn't really as relevant if you have a partner. So somebody can be like, oh, well, you need this if you have a partner with HIV, but not necessarily anymore, because now you can be made non-contagious if you know you
Well,
have
so
HIV.
basically, as long as the partner is taking it, it's okay. But the
Right.
partner
No.
would need
So
to
this is
take it.
really specifically mostly meant for orgies.
Or, well, yeah, well, basically, if you can't guarantee that the people with whom you're sexually intimate are being very conscientious about taking this medication if they indeed are HIV positive, right? So
Yeah.
if one, you aren't being indiscriminate about having sex, or two, you're having sex but only with people where you know they're not HIV positive, or three, you do know they're HIV positive, but you can 100% trust that they're taking this medication, you wouldn't need this. You wouldn't need PrEP.
Yes. But if you are treating sex is just something you do with your friends when you feel like it,
Then you're going to need this medicine.
you're
Yeah.
definitely going to need it. She is not being irresponsible in taking this medicine.
Yeah. Safety first.
Safety first. And she is not spreading HIV because she's taking this medicine. So, I support that she has chosen this lifestyle. But then that got me thinking, okay, how much does this stuff cost?
And who's paying for it?
And who's paying for it? Now, this gets interesting, because this is where I was like, oh, this is a moral quandary. Anyway, so I'm just going to read to you, because I decided to ask Perplexity about some of this stuff. So a month's supply of PrEP, pre-exposure prophylaxis medicine, specifically Truveta, cost nearly $2,000 without insurance. While the generic version is approximately $60 per month, the total annual cost can exceed $21,000 if purchased without any financial assistance or insurance coverage. However, most private health insurance plans, as well as Medicare and Medicaid, are required to cover the cost of PrEP without any out-of-pocket expenses due to provisions under the Affordable Care Act.
Okay.
However, patients may still incur costs related to lab tests and doctor visits, which are necessary for monitoring while on PrEP.
That makes sense.
And that's because it's very hard on your liver. If you consistently take this, you will probably die from it.
So I dug into this a bit more because I wanted to make sure I was correct in this statement. And it turns out that most of the people who are on PrEP are regularly seeing doctors to monitor for dangerous levels of things like lactic acidosis or liver cancer, which they are at a much higher risk of. So while it is almost certainly shortening your lifespan, it is not necessarily going to kill you if you are seeing the doctor regularly for it.
It seems to be my understanding.
Oh, boy.
So they're also sacrificing their health and, lifespan for, these in the moment indulgences.
Okay.
And so
basically, if the government's supporting this, probably they're going for the generic version. You're being prescribed the generic version, and the government or your insurance company is paying. No?
Oh, God, no. Oh, no. Sorry. I've got to keep going here, because we've got to go, who pays for this? Okay.
Yeah. And which is being purchased, the generic or the brand?
To assist those who may not have insurance or whose insurance does not cover PrEP, several programs are available. Advanced Access Medication Assistance Program covers out-of-pocket costs for Truveta up to $7,200 per year. This is a program that is run by Gilead Sciences, the manufacturer of Truveta, and is likely really just a tiered pricing thing. So people don't know, but many companies do this, where they will create another version of their product that they can still be cash positive on, but that only poor people can buy, so that they can make money from those poor people and look like they're doing a nice thing, where really they're just doing price discrimination. Because, they still want to sell the drug, right, to as many people as possible, but they don't want to lower the price for the people who can pay more, right? The next one is Ready Set PrEP, which provides Truveta to individuals without prescription drug coverage. This is a national program run by the U.S. Department of Health and Human Services. It's available across the United States. And then copay relief programs offer up to $7,500 a year for out-of-pocket expenses. And this is offered by the Patient Advocate Foundation and is available nationwide.
Okay, so hold on. They're not paying for the generic. They're paying for the name brand.
I assume that this has to do with U.S. patents, because my understanding is that you just can't get the generic in the U.S.
All right, so I dug into this more because it was very confusing to me as to why people are not buying the generic. So it appears that the primary reason people are not buying the generic is bureaucratic bloat. So a lot of the insurance companies, remember how all the insurance companies had to cover PrEP? Well, a lot of them never added the generics to their sort of approved drugs list, so they are paying for the much more expensive form. So this cost is being passed on just because from the perspective of the customer, they don't really notice a difference. For them, it's free either way because, the Obamacare plan forces insurance companies to carry PrEP, and because they don't carry the generic, people are just buying the more expensive one because the cost isn't going to them. That appears to be what's going on here. But it is going to you. It is going to your child's health insurance costs and stuff like that. Another side here is that the generics only really came onto the market in 2021. And because of that, a lot of the debate around should this be covered and how much it's impacted our healthcare system happened before the price drop.
Okay, so one thing to note here is when the act was passed, it was mandated that all insurance plans have to pay for this. So if a person is sexually active, they have to pay for this and wants this drug. So that means that, outside of, first also let's talk about this program that I was talking about that pays $7,500 a year for out-of-pocket costs for this.
Mhm.
I went to this program's website because this is a nonprofit, right? And I was like, okay, what do they tell people who are giving them money that the money is going to, right? They tell people that the money is going to food and nutritional expenses, utility bills, rent or mortgage payment, temporary lodging, transportation costs, and childcare expenses. So the money that is, and people are like, why is there a moral problem here? Well, it's because of an opt-in lifestyle choice. This money, now $7,500 a year, is going to allow for a lifestyle that I assume many of the people don't know that they are donating to enable, instead of going to sick children. Like you people pretend like this stuff, money comes from nowhere, but no, it's always from something. If it's going to this, it's not going to sick kids. It's not going to utility expenses for somebody's house.
I also think that the bigger issue is that we are now paying in the United States very high insurance premiums. And our insurance covers very little. And when insurance companies are, from a regulatory perspective, obligated to pay for services for certain people, that means that they're going to charge more to everybody else to be able to cover those costs. Again, somebody has to foot the bill. So this is also families who are not able to get insurance at all because they can't pay for their premiums. This is businesses offering much crappier programs to their employees because their premiums are so high. This is people, not having deductibles they can ever meet. Like we're on a deductible plan that I think for our families, something like $12,000 before our insurance starts to cover anything we have to pay. So we might as well not have insurance.
Yeah. The Obamacare has made things insane because insurance companies can't say, well, we won't take you. You need to go for a higher cost insurance if you're going to make these lifestyle choices. Because at the end of the day, going to orgies is a lifestyle choice. And we'll get into how much of a lifestyle choice it is in a second. But I want to finish with the pre-prepared stuff before we get into any moral questionability of this.
Let's do
Again,
it.
it's not just that it's affecting insurance. A number of states just offer this for free to people who want it. So several states have established a drug assistance program that can cover the cost of PrEP, including lab tests and doctor's visits. The states with such programs include California, Colorado, District of Columbia, Florida, Illinois, Indiana, Iowa, Massachusetts, New Mexico, New York, Ohio, Oklahoma, Virginia, and Washington. So a lot of states.
Quite a few states. Yeah.
Totally.
And quite populous states too.
Yeah. So I want to, before we go into the discussion of this, talk about how it works and the current sort of state of AIDS treatment, just because I think that is important to talk about.
It sounds also pretty cool. Like amazing.
I'm glad that this exists, and I'm glad that it's becoming less expensive.
Yeah.
I do have questions about the morality of this being covered by Medicare.
Right.
And being mandated by the government, because that means that you are mandating people who might have pretty strong religious objections to this to essentially be subsidizing lifestyles that they believe, not us, but I can totally understand how somebody would have questions about this, even without having a problem with a person being gay or a person being trans. You can be gay and trans and not go to orgies all the time. This is a subsection of these communities. Not all gay people are degenerates. And I'm not saying that everyone who goes to orgies all the time is degenerates, but probably, there's probably some correlation there. But anyway, I mean, it's not for me to judge other people's lifestyles.
And when I say it's not for me to judge, who is it to judge? It's God to judge. Not me, God. I let people make their own choices and deal with the consequences of those choices. It's not for me to dole out those consequences. However, in our Discord, somebody was asking, do we really want, because a number, especially of gay men, like of the real gay community, not the opt-in LGBTQI+, oh, I'm non-binary today community, but the real OG gay community has been moving increasingly Republican over time. And some people in our Discord were wondering, is it actually good to bring these types of people into the Republican coalition? And one of the things that I have noticed with this community, and a gay person within our Discord was also saying, yeah, this observation that you had is very accurate of the community, is it's sort of split into two groups which kind of hate each other. One is sort of wholesome, mostly monogamous, gay people who are looking for long-term partners and looking to raise families. And even, as a Christian, if I believe that they live a life of sin, yes, but I don't see it as a particularly higher life of sin than a couple that is childless by choice. That they both are engaging in non-reproductive sex for pleasure, like that is bad from my perspective. But again, so I don't, should I, as a state, be breaking up couples who don't want to have kids? Like, no. So I don't see a problem with the other type of couple. And I should note here that I think they're living significantly less lives of sin than somebody who is out there having, straight sex with a different girl every other week and going to nightclubs and partying all the time. But then the other community has just gone full on like degenerate mode. And it is, and you'll see this in another episode that we actually recorded alongside this episode, but that's going to go live on different days, is just how fully degenerate the stuff they're fighting for is these days. It will shock you. Believing Americans have essentially a constitutional right to orgies is low scale on the degeneracy.
So I will read about how it works and what it is. PrEP, is a preventative medication for individuals at high risk of contracting HIV. It is designed for those who do not have HIV but may be exposed to it through sexual activity or injection drug use. And keep in mind, straight people can get HIV too, and straight people might need PrEP as well. Straight people who wouldn't need PrEP are straight people who are in monogamous relationships and trust their partner. So really the thing here, and I think a lot of people will say like you're being homophobic or you're being transphobic, but the truth is that it is not the being gay that makes somebody need PrEP. It's the orgies that make somebody need PrEP, or the treating sex like a handshake among friends that makes somebody need PrEP. If you are straight and you are doing that, you will need PrEP. If you are gay and you are doing that, you will need PrEP. If you are gay and you are monogamous, you will not need PrEP. And the vast majority of cases. Now, there are minor cases that we'll get to in a second. And if you are straight and you are monogamous, you will not need PrEP. So this is about a lifestyle choice, not like an inborn difference between individuals, or maybe is it? We'll get to that in a second. Okay. PrEP involves taking medications that can significantly reduce the risk of HIV infection when taken consistently. It can lower the risk of getting HIV from sexual intercourse by 99% and from sharing needles by at least 75%. So that's a great thing that exists. Yeah. There are two main forms of PrEP. Daily oral medication. This is a pill taken once a day, an injection that is administered every 2 months, which may be more convenient for some individuals. Who should consider PrEP? PrEP is recommended for individuals who meet the following criteria: having a sexual partner who is HIV positive, no consistent use of condoms during sex, having been diagnosed with a sexually transmitted STI in the past 6 months, which basically means they're sleeping around a lot, injecting drugs and sharing needles, or having an injection partner with HIV. An injection partner? You just use a different needle, you fucking nut job. Hold on.
I doubt that those are common cases. They're just outlining all the scenarios. No one wants to share. Malcolm, trust me, no one wants to share a needle. They just get more blunt. It's not fun. So yeah, this is not. I don't think it's a common scenario, especially because there are so many needle distribution programs now. Not an issue.
Yeah, I was asking about what's the probability that somebody who's on normal HIV medication today is contagious to their partner. Based on recent research, people with low HIV viral loads have extremely low risk of transmitting HIV through sex. A systematic review of 8 studies involving 7,762 couples found that the risk of sexual transmission of HIV is almost zero when the HIV positive partner has a viral load of less than 1,000 copies per milliliter. 3 studies showed no HIV transmission when the HIV positive partner had a viral load of less than 200 copies per milliliter, considered undetectable. Across all studies analyzed, there were only 2 cases of transmission when the HIV positive partner's most recent viral load was less than 1,000 copies. However, these cases had long intervals between the viral load testing and transmission, complicating the interpretation. So basically, it's never been confirmed that somebody with a low load has transmitted HIV. The CDC stated that people who take antiviral therapy, ART, daily as prescribed and maintain an undetectable viral load have a quote unquote effectively no risk of sexually transmitting HIV to an HIV negative partner. This concept is known as quote unquote undetectable or untransmissible, or U equals U. And it's actually so low now that there is a sperm bank for HIV positive individuals that's inclusive of them. So I'll talk a little bit about this sperm bank, because this shows you how low it's perceived as within the community. Based on the latest scientific evidence and updated regulations, sperm and egg donation from HIV positive individuals with undetectable viral loads can be safely done without transmitting HIV to the recipient or the resulting child under certain circumstances. The donor must have sustained undetectable viral load, less than 200 copies, for at least 6 months prior to the donation. The donor must be on an effective antiretroviral treatment for at least 6 months, and the recipient must be informed about the donor's HIV positive status. And this is, and I'll post it on screen here, called Sperm Positive. And the 2 women on it are 2 fat women, of course, with a baby, a lesbian fat interracial couple with a baby. Nothing that there's anything wrong with it. They just look very stereotypically like SJW, which is fine. I guess that's the type of person who would want this, right? I actually think people expect me to be like more against this. If a couple is informed that that's what they're doing, and they're doing this, I don't know, for them to just.
Well, Malcolm, if in the end you are, someone who through things that happened in your past. Listen, people, I don't think consensually choose to have unprotected sex with someone who's HIV positive. It happens once, whatever. And then, that's something you have to live with for the rest of your life. I think it's great that these people are still able to have kids if they want them. That's fantastic. So yes, I think we can all agree that this is a fantastic medical treatment, and that I'm really glad that this exists and that it's available as an option. This is great.
Yeah, but the question is it ethical to force families to subsidize this?
And this is where I feel like it's less of a gray area than you are. Now, I understand from a governmental and policy perspective that it's, here's a chance for a government to quash the spread of a very dangerous disease where there is collateral damage, when you don't openly control it in this way.
Yeah. And I want to highlight the collateral damage that he's talking about here. During the AIDS epidemic, little kids died from like blood transfusions or like, you step on a needle in a park. As the rates, it's not just the people who have consciously chosen behavior that you disagree with who end up suffering because drugs like this are not widely available. Anyway, continue.
Yeah. At the same time, I do have some doubts about this because, as you point out, this is a lifestyle choice. You do not have to have sex with people in a way that would require you to take this medication. And when I think about trying to find an equivalent that's not charged, this might be, okay, well, maybe, my life is better. This is part of my identity, right? My identity is that I am, gay and I have sex in this way. And it's just like part of my expression. It's part of what I do to have fun. But I think a lot of people, identify as, social butterflies who like to go out and, have a nice brunch once a month, right? Let's say that the actual cost to governments and insurance companies, like marginal, is $60 per person, to be like $65 per person, bare minimum, right? Mm-hmm. So what if also, for some people to live a happy, fulfilled life, they went out to brunch with their friends once a month because that made them happy. And that costs, for them, a good boozy brunch, $65 per person. Should the government also subsidize that because it's part of their life? It makes them happy. They wouldn't be as happy if they didn't do it.
I thought the thing that you said to me really moved my mind on this is you're like, yeah, what if somebody wants like a nicer apartment, right? Like, does the government have to subsidize that nicer apartment because it would, it's
It would
part
make
of
their lives
lifestyle?
better. They'd be much more comfortable.
Maybe
Yeah.
they're in a long distance relationship with someone, right? Does the government have to subsidize their plane flights? Or they like to travel to Europe once a year? That's part
Yeah.
of who they are.
Yeah.
Does the government have to subsidize that? Is it moral to have families that are struggling to get by, that are struggling to, whose kids have diseases and stuff like that, to be taking from like kids' cancer funds to fund this? Is that moral?
Yeah, and that's where I really question it.
I think you're right here, but here's the question I would have, because this is where I do support it. I do support it in instances where somebody has a committed monogamous marriage and their partner is HIV positive. In that case, do you still not support it? Now, remember, they can be basically non-transmissible, but it's still recommended they take it. I guess I wouldn't even support it there, and I'll explain why. It is not that we are saying this drug should not be accessible to anyone who can afford it. There are tons of things involved with a monogamous marriage that people choose to afford to have sex, for example, right? Like, if you're in a monogamous marriage, but you don't want to have kids yet, so the government be forced to pay for your condoms?
Or birth control.
Yeah.
And like there are plenty of religious groups that are not really in favor of insurance companies by default covering the cost of birth control pills, for example, or
yeah, I mean,
inserts.
even between a husband and wife, I even still think, so keep in mind, we're not talking about gay couples here. I'm talking about a husband and wife where one of them is HIV positive. I unfortunately think it is not the government's responsibility to cover this. I would like to see the price continue to drop and for it to be more affordable. But I think at the end of the day, sex is a recreational activity.
It's an option. Yeah. Like, well, and if we're going to subsidize recreational activities, then the question is, well, why aren't we subsidizing all of these other things? What if this person is, anxious and they really hate taking public transportation because, they're autistic. Like, I'm autistic. I had a huge fear of public transportation for a very long time. Like, should the government pay for my Ubers? Like, there are all these questions that this opens up, and it just, I don't know really, unless we're capable financially of subsidizing a whole bunch of other things, which we're not. How can this be justified? I guess, so there's, we have to come back to the public health question of what about, the children who may be born, who may have HIV because this wouldn't be subsidized. That's, that's where I start to get like, when kids get hurt, I draw a line, I can't deal with it anymore. So that's one potential issue. I also think about the fact that like a lot of people from this is my identity and lifestyle perspective make a lot of financial decisions that are unsustainable for them. Like, let's say like I'm the person who identifies with, having a boozy brunch once, every month. And then they put that on credit card debt, and then their debt sort of spirals out of control, and then they can't retire, and their children are forced to take care of them in old age, or, worse, they become, a burden on the state, and all these sort of bad things happen. So I would also argue that it's not just with, HIV risk, where people can cause a lot of damage to others, like collateral damage, by being irresponsible and pursuing their hedonic pursuits, such as eating out or taking an Uber instead of public transportation or walking, for example. So we can't even say that like, oh, this is different,
This is the other interesting thing that's come down from this, is that this went viral. That short fat otaku saying you need to take pills to not contract HIV, you can just not have sex with people who have HIV, was such an offensive thing within this modern cultural context that we're in. Advocating any form of restraint is seen as a sin. I think that that's one element of it. But I also think, because keep in mind, this isn't a gay versus straight thing. This is a orgies, sex with strangers versus non-sex with strangers things. Is that now a culturally sacred practice to the urban monoculture? Is the orgy now something that they consider almost like a sacred religious tradition, which must be subsidized by the state?
Well, so was the reaction mostly negative, or was it a lot of the people?
Mostly negative.
Wow.
Mostly negative and horrified negative. Like, this guy needs to be off the internet. They said that he was trying to commit genocide. They said that he was, it was extremely, extremely negative. And,
Okay.
here I want to put the South Park clip of them all having gay sex in the human race, because that's sort of where I feel the urban monoculture is going these days. It's like they don't have a reason to keep going. And so they've invented this strange orgy ritual. And now it's become a sacred cow for them.
These unemployed men have been having sex for several days. Joining me now is their spokesperson. What exactly are you trying to accomplish? We're doing the only thing we can do. We have to take matters into our own hands. We're trying to turn everyone gay so that there are no future humans. Present day America #1.
And I think that people outside the urban monoculture, because there's some things with the urban monoculture where you just don't realize that there's like this new sacred line that's been created, and that if you cross it, you get like beaten down. And the sacrosanctness of being able to have sex whenever you want, with whoever you want, without any consequences, is now like a sacred thing.
Yeah, I'm noticing that it's something that, as a candidate for state rep, I'm also coming across. Like, I get a lot of candidate questionnaires from groups that may or may not endorse me as a candidate, right? That may or may not donate to me too. Like, they sort of want to say, like, these are our, official candidates that are approved because they are with us on policy. And just today, I received an email from a big LGBTQ plus group in Pennsylvania. And I was like, oh, this is awesome. Like, I can fill this out and they'll see that we're super supportive of, basically LGBT rights.
Uh-oh.
And then I start going through the questionnaire, and it's not really about rights or freedom. It's about making people who choose to classify in certain LGBTQ plus categories a protected class. It's about regulating protections and privileges for them that go above and beyond standards to which normal people are held. And I got really uncomfortable, like, looking at the questions, and I'm just not going to fill it out, I think, because
I actually think maybe we should do an episode on the questionnaire.
Oh, yeah, maybe we should, because it was, I went in and I was like, oh, this is going to, like, slam dunk. This is going to be great. I can show to centrists and Democrats in our district that, like, oh, actually, we're pretty socially progressive. And then I'm going in and I'm like,
we are not. So are you realizing that we're not socially progressive anymore?
Apparently not. Apparently I'm an evil bigot. Like,
because what socially progressive means now is that you believe that class, like our society should be divided into different caste groups that have different levels of rights to human dignity. Ethnicity is one divider here, but gender is another opt-in divider. You can opt into this like non-binary identity and be treated as
and suddenly get all these, per their preference, suddenly get all these additional protections and privileges.
What are some examples
that are not afforded to other people? So I have a thought experiment for you about sort of, where are we going to end up on PrEP, right? Because we've kind of already said the state shouldn't subsidize people's lifestyle choices, especially if they're culturally based, and, kind of like, well, you don't have to pursue this, or you could pay for it yourself if you really need to, right? It's a nice to have, not a necessity. Yeah. We've known young people who definitely use like government healthcare and who definitely use PrEP and who we really like. And if there was a world where like the government stopped paying for PrEP, like, or what if we were sitting across from them, like having drinks, and we're having this conversation and they're like, yeah, well, but I use PrEP, and I can't afford it. If suddenly the state's not paying for it anymore, like, do you want me to get AIDS? What do we say to our young friends?
I want you to exercise And I think that this is a really interesting thing that was in the urban monoculture, explaining to someone that there are consequences for their actions and that they need to exercise a degree of personal austerity for their own financial or health safety is seen as sinful. And so within their cultural framework, I'd be like, I understand that there's no way that you could really understand what I'm saying to you. But from any sane cultural perspective, you are sometimes asked to exercise some degree of discretion and austerity. And an episode that we're going to do after this, we actually go into an organization that is campaigning to try to have it be that gay individuals cannot be persecuted for lying to another gay individual about them not having HIV. So I can understand why people are freaking out there if that's what their culture is fighting for, is that people can just go out there and do whatever they want and there should never be any consequences for any of their actions. But I'd say, do I feel bad that I'm saying that your culture actually does need to learn to sometimes exercise austerity and sometimes to change cultural norms around risks? Yeah. I mean, I'd point
I think
something out.
actually here's where I would probably come down. I'm actually trying to model a conversation with this young person who I quite like.
Okay.
Because I don't have a problem with him sleeping around and having fun. Like it's actually kind of cute because we used to like kind of talk about like people that he was dating and stuff and like whatever, like I would feel the same if it was a young woman. This is fun stuff, love, young love. I would say, listen, okay, like we can look for some of these programs. The generic version could be as low as $65 a month. Let's find a program where you can get it $65 a month. Okay, what do you have to do to get an incremental income of $65 a month? Okay, you can probably, create an account on TaskRabbit or, create an account on any like gig worker platform. And for like 1 weekend a month, spend 5 to 6 hours doing some gig work to get the $65 to pay for the medication that will make sure that you can do this all safely. I guess that's what I would say. Like,
what if it turns out it's not $65 a month and it's actually $2,000 a month, like the first estimate said?
Then we're gonna have to work out how you can make. Honestly, like I'm super okay with just being like, if you want to have that lifestyle, like let's get that lifestyle.
Yeah,
but you're gonna have to work.
Or how do you cut $2,000 a month in expenses?
Yeah. And like, and life is about trade-offs. Like, we didn't make the government pay for our IVF. And actually more and more people keep reaching out to us being like, hey, how can I get my IVF paid for? Like, you're going to have to find a way to pay for it. We gave up travel. We gave up fun. We gave up every luxury in life. We lived on a mattress in the warehouse district outside Miami for a year in a studio apartment.
In a studio apartment, so just like
mattress on the ground. Like, I think we shared one chair between the two of us. Maybe there were two chairs.
Well, because we don't sleep in the same bed, I had a tent in the room, and you had the mattress right next to me.
Yeah,
which I absolutely love.
It was nice, but we sacrificed. And I think the thing is, in the end, it wasn't that bad. Because when you know what you care about and what you don't care about, it's actually easy to make those sacrifices. And a lot of people pay for things they don't really need. So then we probably talk with this friend and be like, okay, well, like, what do you really care about? Like, what can we cut out that is not as important as you having sex with like fun people?
I actually want to point out how the perversion of a society that sees it as a moral necessity to pay for a drug that enables sex whenever you want, but that doesn't see it as a moral necessity to pay for IVF, the creation of new human life.
Oh, shit. Yeah, I didn't even think about that. I think, where we fall is people should not be granted privileged status based on group membership to pursue their cultural values. That we believe in cultural sovereignty, and the way that we support that is by saying, you do you, don't force you on us, and don't make us pay for your lifestyle. And that's fine. And I think that's a pretty fair stance. So
yeah, but unfortunately, it will be seen as transphobic. Because I don't know. Like, it's actually homophobic and transphobic to try this issue to gays or trans people because
paying for PrEP.
Yes, because straight people are at almost as much risk if they are out having orgies. Well, a little less because transmission rates are less, but they're still at risk too. This is not a gay straight
people.
This
like
is an orgy non-orgy
issue. With you? I mean,
all right, I'll get the mic to Octavian, and I'm gonna go get the other kids.
Okay, I love you. Bye. Hey, Octavian.
Yeah, I got the toys right here at the box. Like, Stacy doesn't need any more toys. Only just a teddy.
Yes, because we don't like having a lot of clutter everywhere, right, buddy?
Right.
Right. Can you tell everyone to like and subscribe, please?
Oh, yes.
Go ahead.
Do I got to subscribe on here?
No, ask them. Say, please like and subscribe.
Please like and subscribe.
Okay, life and describe, people. Life and describe. I love you, buddy.
Love you too.
Blackberry, do you want a blackberry?
Oh, yes, thank you.
You want to go out and get a blackberry with me? Here, have the fans seen you, Toasty? Okay,
Especially,
you go get it by yourself. You go get your own blackberry.
especially, we are great.
What were you talking to Mama about?
He told everyone to life and describe.
To like and subscribe?
To life and describe.
To
Yeah.
life and subscribe.
I did not did it.
No. To
here.
life and describe.
I
Oh,
it's
to
on
life and describe.
here.
Octavian, sometimes are you not able to do a fun thing that you want to do?
Well, I do like doing the fun thing. I just like toy trains.
Should the government, Octavian, should the government pay for your toy trains?
Food not on train, then I cannot eat it.
Oh, you can only
Food.
eat food on trains now.
Yeah.
This is in relation to the sushi train we got them.
Daddy? Yeah. I find it not Billy.
Good job.
Good job, Toasty.
But-
Octavian, should the government buy you trains?
Yes, I really like food on train.
So you
Okay.
like it, and therefore the government should give it to you.
Yeah.
We're gonna have to watch out for you, buddy.
Hey, remember, he likes communism.
Oh, hold on. I'm gonna lift Titan up so they can see her because they haven't really seen her talking.
And remember, Octavian, real communism has not been tried.
What are
Hi,
you gonna say? No,
Titan.
what do you want to tell
Hi,
mommy?
Titan. What do you want to say?
Take a lot.
Oh, you just took a walk. Titan wants the mic too. Can you ask Titan a question, Octavian?
Karen.
Sharon is Karen. You know, they what they do now, and I call it Sharon Karen, as in like bad woman Karen. They go up to one of their siblings, they immediately like snatch something, like they do something asshole-ish, and then they say Sharon Karen, which is just so appropriate. It's the Sharon Karen.
What do you think of that, Titan?
I love you, Titan.
All right, you can come down. I'm sorry for holding you. Ah! I love it when the news is like, you hit your child. How could you ever lightly hit your child? And then you see our children, and you're like, oh.
They're clearly terrified of you, Malcolm. They're clearly terrified.
Oh, yes, it is.
Oh
So,
yeah.
Mommy,
All right, Malcolm. I love you.
All right,
Hit end
see you
recording.
hi.
I love you, Mom. You tell Mommy you love